Hello, my name is Angelica Ponguta, and I am research scientist at the Yale Child Study Center. I am part of the Policy and Global Peace Building research stream here at the center. And today I will share with you the key findings of a study that was conducted in collaboration with the Arab Resource Collective, which is a leading non-governmental organization that operates primarily in Beirut, Lebanon. So the problem that our work addresses is quite daunting. Over 230 million children as of 2019 had been forcibly displaced globally, and extreme poverty impacts over 380 million children. These statistics are an underestimate of the current state of children, since they predate the advent of the COVID pandemic and additional geopolitical crises that have ensued since. So our work aims to elevate parenting interventions in early childhood as a strategic investment in fragile contexts. We know that early childhood adversities negatively impact the developmental trajectories of children. We also know that parental mental health and practices are key protective factors against those adversities. And yet, despite this knowledge, there is a lack of empirical studies that demonstrate the impact of parenting programs in fragile and hard to reach settings. So to address this need, we conducted an impact and a process evaluation of the Mother-Child Education Program, or MOCEP, which is an intervention that targets maternal skills to support early childhood development and education. Importantly, the trial was conducted among 2 refugee camps, primarily hosting Syrian and Palestinian refugees, and 1 marginalized Lebanese community. Additionally, we conducted path analyses on the baseline data to test the associations between maternal stress, key contextual variables, and father involvement. So together, our studies yielded 3 key results that I would like to highlight. Number 1, the program had a positive impact on disciplinary practices, and it decreased parenting stress. Yet broader effects on maternal and child outcomes may be dependent on program attendance. Number 2, parenting programs like MOCEP that combine group activities and home visits are feasible, and robust evaluations like ours, although very challenging, do have key enablers that we unpack in our second paper. And then thirdly, maternal perceptions of her husband's involvement may alleviate the parenting associated stress among mothers living in underprivileged communities. But importantly, the involvement of fathers is a critical aspect of programs design, which tends to get overlooked. So ours was a pilot trial and a meaningful proof of principle study. But there is clearly a need to disseminate this knowledge more broadly, and in particular, determine paths to scale of interventions of this nature. We continue to work alongside our partners at the Arab Resource Collective in order to expand this evidentiary base, as well as with a larger network for strategic advocacy for parenting education and support in both national and global settings.